In this video, we will discuss bleeding, swelling, eating, oral hygiene, and your prescription medications. For the remainder of your recovery. For the remainder of today, you will be bleeding a little bit. We ask that you not spit. Spitting will only prolong the bleeding as it will dislodge the blood clots. If you feel like you need to clean your mouth, we ask that you take a paper towel and just wipe the inside of your mouth. Following the removal of your teeth, we ask that you not drink from a straw. Drinking from a straw will only dislodge the blood clots, increasing bleeding. For those of you who smoke, we ask that you refrain from smoking several days following your surgical extraction. Smoking will increase the chances of infection and compromise healing. It can also cause something known as dry socket, which is incredibly painful. Following your surgical extraction, we ask that you leave the surgical areas alone. Try not to poke or pry with your finger or your tongue. This will only dislodge the blood clots, increasing further bleeding. Let's talk about bleeding. Minor bleeding is normal following your surgical extraction. This can take several hours to stop. You would have been given some gauze following the removal of your teeth. We ask you to use your gauze and change it every 20 to 30 minutes until the bleeding has subsided fully. As soon as you get home, change your gauze. And moving forward, you're going to change it every 20 to 30 minutes by folding the gauze like so. Fold it in half, in half, in half, and in half until it looks like a little square. You're going to take your gauze and place it directly on the surgical area. So wherever we removed a tooth, place the folded end directly on the socket area. Bite down firmly. The pressure of the gauze is what stops the bleeding. It's not the soaking of the gauze. So the more pressure, the better. Change your gauze every 20 to 30 minutes until the bleeding has subsided. If you run out of gauze, you may use a clean paper towel. Swelling. Swelling is normal following your surgical extraction. And everybody's different. Some people swell, some people don't. Do not be alarmed if you start seeing a little bit more swelling on days 2, 3, and 4. Again, swelling can worsen day 2, day 3, and day 4. Don't be alarmed if you see some swelling for up to 1 week or further following the removal of your teeth. Do not be alarmed by some bruising following the surgical extraction. Some people may bruise, and that's okay. You may see some bruising externally along the jawline as well as leading down your neck and can vary in different colors depending on your skin tone. There are several ways to alleviate swelling. Number 1, ice your face. Take an ice pack and place it directly on the outside of the face. 20 minutes on, 20 minutes off. If you remove teeth on either side of the face, then you want to place that ice pack directly on the side that were removed and then start alternating. 20 minutes, 20 minutes, 20 minutes, 20. If you remove teeth on the anterior front portion of your mouth, then you want to ice directly on that site. 20 minutes on, 20 minutes off. At bedtime, we're going to advise that you do number 2. Number 2, now that it's bedtime, we're not going to ask that you ice your face, but rather elevate your head. So with a couple of pillows, prop yourself up. That elevation will help keep the swelling down over the next several days. The number one question most people ask, what can I eat? For 1 week following your surgical extraction, we ask that you consume a soft diet. Your soft diet can consist of foods such as yogurt, pudding, pasta cooked well, noodles cooked well, ice cream, milkshake, avoid that straw though. We ask that you not consume anything too temperature hot the first day. Anything too temperature hot will promote bleeding, so allow your foods and beverages to cool down to room temperature before consumption. Try to avoid chewing directly on the surgical area. Stay well nourished and well hydrated. This will ensure that you heal faster and more comfortably. Your oral hygiene. On the day of your procedure, we ask that you not brush your teeth. This will only disturb the blood clots, prolonging the bleeding. A day following your surgical extraction, you can now go ahead and start brushing your teeth, but avoid the surgical areas. Dr. Jason Wong would have placed some stitches in the area. They're dissolvable, they'll fall out on their own at any point, but avoid brushing directly on that area. So avoid touching the surgical areas for 1 full week. Rinsing. Again, on the day of your procedure, we ask that you not rinse your mouth. Rinsing will only prolong bleeding as it will disturb the blood clots. If you need to, again, wipe the inside of your mouth, but no rinsing. A day following your surgical extraction, we're going to ask that you start using your warm saltwater rinses. Warm saltwater rinses act as an antiseptic to prevent infection. Take a cup of warm water with half a teaspoon of salt, gently swoosh for 30 seconds, open, don't aggressively spit, open and let the water drizzle out. You want to do this 3 times a day for at least 1 week. Your prescription medications. Dr. Jason Wong might have prescribed you a prescription medication. We ask that you follow the instructions carefully that were given to you by your registered nurses. Some medications can cause a bit of upset stomach. We ask that you take your prescription medications with a full glass of water or with some food. If you experience any nausea, vomiting, or diarrhea, we ask that you contact us. If you were given an antibiotic, we ask that you please complete the full course of your antibiotic. This is to prevent any infection. Following 1 week from your surgical extraction, we ask that you start brushing directly on the surgical areas using a clean, soft toothbrush. Dr. Jason Wong may or may not have placed some stitches in the area. Those sutures are dissolvable and will fall out. We encourage you to brush directly on the surgical areas very gently, using your toothbrush 3 times a day. Do not be alarmed if you see some gingival or gum bleeding in the area. That is completely normal. The gums will take a little bit of time to fully heal. 1 week following your surgical extraction, you may resume a normal diet. Don't be alarmed by some gingival gum sensitivity. Your gums will take up to 3 weeks for full healing. Dr. Jason Wong and his team, thank you. If you have any questions or concerns regarding your recovery, feel free to connect with us.